If you don't have a big problem, you don't need a big operation. There are some terrific minimally invasive options, things like Botox or Restylane, Juvederm, Radiesse, chemical peels, VI peels, and laser resurfacing that can help you look your best, help minimize the downtime, and get you the results that you want. These are the things that we call the lunchtime lift or the liquid lift. Hi, I'm Dr. Navin Singh from Washingtonian Plastic Surgery. My practice is based in Chevy Chase, Maryland, and in McLean, Virginia. Let's review what we can do over a lunch break for you. This is what we think about when we think about a liquid lift. Doing Botox and fillers and or a chemical peel to help rejuvenate, refresh, but without going under the knife. It's attributable to any number of factors like not enough sleep or too much screen time. And people have mild asymmetries or sometimes significant asymmetries in their face. That's okay. We're not the same right to left. You can't write as well with your non-dominant hand as you can with your dominant hand. Most people have a preferred side of the bed on which they sleep, and that creates heaviness or puffiness on one side of the face versus the other. And if you think about the car, when you drive, you've got that left hand and that left arm and your left side of your face that gets a lot more sun exposure than the other side. If you want to have fun with trying to figure out how symmetric or asymmetric you are, there are any number of smartphone apps that you can download, including ours, and you can look at your right and left symmetry. We're not the same on both sides, but my job is to help create as much symmetry as possible, realizing the limits of it, and get you looking your best over a quick lunchtime. There are many areas of the face that can be treated, everything from frown lines or forehead creases, crow's feet, the nasolabial creases, the marionettes, the pre-jowl sulcus, a lot of fancy doctor words. But when you come in and see me, we'll break it all down, analyze your face, share with you what I see and what the quick fixes are to get you the results that you've always dreamed about. Overall in the nation, the amount of non-invasive or minimally invasive stuff that's going on, meaning like Botox, filler, chemical peels, laser, that's skyrocketing. Why? Because people don't have the downtime in this go-go lifestyle. And these are quick fixes that can get a lot of bang for your buck. So the top 5 non-surgical procedures typically are Botox, chemical peels, etc. And those are what we employ in our turbo lift or lunchtime lift or liquid lift or what have you, whatever you want to call it, the injectables and topicals that get you where you want to go. Of course, as I analyze, you have to look at your skin type. There's a Fitzpatrick scale that grades you from 1 through 6. We want to choose the modalities that work best with your ethnicity. Where I practice in the Washington, D.C. area, it's a veritable United Nations of people. We see people from all 6 inhabited continents of all complexions, and so we want to be particularly tuned to you and your skin type. In doing chemical peels is basically removing the superficial dead layer and revealing the baby skin underneath. It gives you a rosy complexion for a little while, you're a little pink for several weeks, and then it abates and you're left with nice, new, healthy skin. Slides from a VI peel showing you different complexions of people with different problems, from fine lines and wrinkles to acne to scarring to hyperpigmentation, and how those are improved with a chemical peel. Here's a close-up of a woman who's undergone several VI peels over the last couple of years. She comes in probably every 6 months or so to get rejuvenated with minimal downtime. Now, of course, everybody has heard of Botox, and it has great applicability in several areas that weren't initially imagined. You can use it to treat wrinkles in the face, as well as problems elsewhere like sweating, and we'll touch upon all of those. The way Botox works is it takes the underlying muscles and weakens them for the time being, for about 3 to 4 months. And in softening those muscles, the muscles that are typically folding your skin, they stop folding your skin, or they at least become weaker, and it gives your body a chance to fill in collagen where the skin has been weakened by the constant motion where the body has dissolved some of the collagen in that crease. So Botox and injectables in the facial area are used to treat these multiple areas. Every muscle of the face that can be injected may have to be injected to cause fine little balances where there has become an imbalance in the muscle action. Here we see somebody that's treated in the glabella or the 11s, and at maximal frown, it's softened. Somebody treated for the lines in the forehead. Those lines are softened, she looks younger, loves the results. Again, treated in the glabella as well as in the crow's feet. The glabella being this, the crow's feet being this, helps soften up those fine lines and helps raise the eyebrows to make you look more alert and vivacious. Now, we don't want the Jack Nicholson eyebrows either. You can see this woman who chose not to have an upper eyelid lift. With Botox, the eyebrows have come up to the right position and she looks brighter and alert and her eyes are more wide open after just Botox injections. A lot of guys do it too, and we joke around the office, we call it Brotox, and about 30% of the people that come in for fillers, etc., are men. This individual came concerned about this worried look, so I guess it was concerned that he looked concerned all the time, and he just wanted to look more at ease. With Botox right in the glabella, meaning these lines, as well as strategically placed in various spots on the forehead, allow those muscles to relax, and consequently, he has a more at ease look. Some people have lines that are so deep because they've been there for so long that just putting in Botox and relaxing those muscles is not enough. In addition, we have to put in some filler to take care of the long-term weakening of that collagen in that area. Imagine if you're taking, a pair of pants or jeans and you've ironed them in the same spot. That's almost a permanent crease. I tell people you'll need Botox in that to soften the muscle. And if you do it often enough, sometimes that collagen will rebuild. But if you want to treat it immediately, it's best treated with a filler. Another person who had a coin slot right in the middle of her forehead, a combination of Botox and filler addressed those concerns for her. So there are muscles that can draw down the corners of your mouth as well. They're called the depressor anguli oris, the DAO muscles. And if those muscles are overactive, we can put in just a few drops of Botox and help the smile corners come up. And if you look at Meg Ryan's smile, that's what people say, can I get that smile by turning up the corners of the mouth? That doesn't uniformly happen with Botox in those areas, but for those people whose muscles are tight, we can create that kind of a result. Botox is also helpful in spastic muscles around the chin. We call that peau d'orange, fancy doctor word for orange skin, where you get dimples in the chin line. A couple of drops of Botox can help relax that muscle. One of the things that we see either from people who grind their teeth and thus have overdeveloped their jaw muscles, or just people who have it because of their ancestry or their heritage, these strong jaw muscles, the masseter muscles, can be softened with Botox injections. This depicts a woman who had Botox injections, and you can see she sort of had a squarish jaw, and 4 months later is becoming more triangular, becoming more delicate and more feminine, which was her goal. These 3 dots represent the sites of injection for treating overdeveloped jaw muscles, the masseter. Again, another rectangular face or square face that's becoming more heart-shaped or triangular-shaped as the Botox kicks in, the muscle thins out, and she starts to look the way she wants to look. And another woman depicting the same thing, softening of the face, going from square-jawed to more heart-shaped jaw. Some people have very developed lines in their neck, whether they're going across as pearl necklace lines or vertical bands, and those can also be treated with Botox to soften them up. And interestingly, some people with mild rosacea may be improved with Botox. This is still investigatory, but a lot of that redness can be improved with MicroBotox injections into all of these areas. So rosacea can be treated with MicroBotox. The mechanism is that it decreases the tension in the face, it decreases oil production from the sweat glands, so those sweat glands, those pores, start to atrophy or thin out and the skin can look tighter and improved. those pores are shrinking, the muscles are relaxing, and we end up with decreased oil production, all of which help create a younger looking face. Botox can also be used to treat a gummy smile for people who have something called vertical maxillary excess, meaning an overdeveloped upper jaw where when they smile, all you see is gum. By strategic placement of Botox in the levators, the muscles that elevate the gum, we can drop that down to create a nice result. And sometimes we can combine that with fillers like Juvederm into the lip itself to create a fuller lip and lower it down as depicted in this patient who had a very lavish smile, and now she loves to smile. And as I indicated before, it can be combined with filler in the upper lip to create fullness that hides the gums. Or in combination for somebody who had Botox to lower the lip, as well as filler to help improve that snarled look in the nasolabial crease, which is right here. There is a developing theory that some hair loss might be improved with Botox by decreasing the tension and increasing the blood flow. And whether it's for men or women, this is an ongoing trial to see if hair growth can be improved with Botox, little micro injections. Of course, excessive sweating can be treated with Botox because Botox interrupts the signal from the nerve to the sweat gland. So sometimes we see athletes who have very sweaty hands and they want to have Botox so that they can grip the ball better, or executives who are tired of a cold, clammy handshake, or women who sweat so much in their armpit that they're afraid to, literally raise their hands, and they're embarrassed. They go through too many clothes. So Botox can improve that as well. So how long do the results last? This study, which was recently published, shows that the effects of Botox last about 3 to 4 months, especially in the glabella and in the forehead. Around the crow's feet, they last about 3 months. But the overall picture, when people have had all 3 areas injected, looks great for about 4 to 5 months because it's a composite effect. So you know that it's easier to maintain something than to put in for a major overhaul. And that's what the liquid lift does. It's a maintenance program between fillers and Botox that helps you look tasteful, classy, and young for longer, putting off the need for a more invasive procedure later on. Now, of course, there'll be some people who do need surgery, whether it's an eyelid lift or a facelift. But for the vast majority, the injectables, the non-invasives, the liquid lift can get those results. But our goal isn't to give you a duck face or a puffy face or to freeze your face. Those are not our goals. Those aren't your goals. Because a face without expression is a mask. We don't want a mask. We want you moving. We want to minimize the risk of looking artificial. We want to minimize the risk of a bruise. We put cold compresses on there to help tighten up the blood vessels. But of course, anytime a needle goes through the skin, it's always possible to get a bruise. So the goal is to look wholesome and natural. These are the fillers I typically use. I like Juvederm. We use Restylane and Radiesse. Each person, each body reacts differently to these products. So we try to choose a product that's most appropriate for that specific person. It's tailored to you. For the upper lip, we want to highlight Cupid's bow with an injection right along the lip liner. And that also improves the little lipstick lines or the smoker's lines that many people have. Even non-smokers have them. Here's a lip augmentation about 10 minutes after the injection. Another lip augmentation. And the lipstick lines, those little cracks right along the upper lip, those get better when filler is placed in the lip itself because it supports that area and prevents that skin from collapsing like a little sinkhole. Another lip augmentation looks very natural, no ducky lips in our practice. And the other areas that can be improved are the tear troughs, these little cheetah lines that people have on their face. And with filler, like Restylane or Juvederm, those can be layered in, and that transition from the eyelid skin to the cheek skin can be blended in so the dark circles can be improved in terms of their appearance. There are 3 grades of tear troughs, meaning those dark lines, and some require surgery and others just require filler or fat grafting. The reasons for the dark circles are listed here, and the people that respond best are the ones with thicker skin, a better color, and a more defined hollow. Some people may need an injection of a filler just off the shelf that takes 10 minutes, or a fat graft, which is your own fat, like a teaspoon taken out and placed into the tear trough. That takes about 45 minutes. And some people may need surgery. Of course, we want to choose the simplest option for you. This young man had fat grafting placed into his tear trough. You can still see the hint of yellow. He's about 1 week after the procedure, showing a nice natural result and a good transition. He loves it. With either Restylane or Juvederm, or with Radiesse, which is a calcium-based filler, which does better on top of bone, we can essentially even do a cheek implant without doing surgery. Putting filler in those cheek areas can improve it. Well, you've heard me talk about fat injection. What is that? Basically, we can just liposuction out with a little needle about a tablespoon of fat, purify it, and each 10 cc's of fat has about 1 million stem cells. We want to purify it, get the best fat, and then deposit it into those areas that we want to create a more natural result. Because some people do lose volume in their face as they age, and in particular in the tear trough area or the nasolabial crease. Fat, of course, is natural and it's fully biocompatible, but some of it does resorb, so we have to overbuild it a little bit. Here we see fat grafting to the upper lip, just looks natural and soft, and can also be used to correct deformities. Like this woman had hollowing out in her temples from previous neurosurgery, and with the placement of fat grafts into that, takes on a natural contour. More fat graft to the lips. That seems to be a very popular site. I recently authored a chapter in a textbook on the biology and science of fat grafting. And in this, we sort of recognize that fat grafting is like transplanting a tree. If you move it, it's undergo some stress, shed its leaves, but then once its roots develop, it'll start to put those leaves back on again. It's going to be the same with those fat cells. Initially, they may lose their fat, but then once they've taken root, they'll start to absorb that fat back in and plump up. Here we see fat grafting into the cheek to create a more youthful, more vigorous look. And other times, besides fat, we'll use different fillers, like calcium-based fillers, such as Radiesse, for deeper correction at the level of the bone. We can place Radiesse in the chin on something that's called the pre-jowl sulcus, meaning as you start to lose volume along the chin line or you get droopiness, we can correct it with Radiesse there. Or along the jawline to create the effect as if somebody had a stronger jaw or the jaw implant, but again, doing it without surgery. Now, if all you have is a hammer, everything looks like a nail. We have to recognize the face for what it is. There's some people who age by deflating. So if a balloon is deflating, it needs more volume. So those people need fillers, whether it's in the tear trough, nasolabial crease, the chin point, what have you. But there are other people that age with descent. That means everything's starting to drop down. Those people will need a lift, whether it's an eyelid lift or a face lift or neck lift. And many people will need a combination of both. Because our practice offers the full range of surgery and offers the full range of fillers, we're confident that we're going to come up with the right treatment plan for you, as opposed to just trying to have you fit into the same pigeonhole for everybody. We don't want to do that. It's got to be customized for you. Depiction of filler in the nasolabial crease. Another with filler in the nasolabial crease. 76-year-old man with 1 syringe of Juvederm into each nasolabial crease. And this shows you just 5–10 minutes after the injection. People are just a little bit red. You can cover it up with makeup. You can walk right out of the office after that filler injection. And you may ask yourself the question, do plastic surgeons themselves do this sort of stuff? Well, somebody did ask that question, and they did a scientific study published in Archives of Facial Plastic Surgery. And about 100% of plastic surgeons offer Botox in their practice. and a significant percentage of them do get Botox. I get Botox. And of the doctors that offer filler, many of them offer the hyaluronic acid fillers like Juvederm and Restylane, as well as Radiesse. And there are some other ones that are much less popular. And of the plastic surgeons who themselves have had filler, most of them have had Juvederm or Restylane, a hyaluronic acid-based filler. So we've spent a few minutes together here learning about what's involved in a lunchtime lift or a liquid lift. If you need it, find us. We'd love to take care of you. Thank you very much.